Welcome to the class of 2022. So we're delighted to have you on board. So what I'm going to do is now just set the scene, and I'm going to try and convince you that this is a fantastic time to be doing an internship in health data science, because what we've seen over the last 2 years is that health data has come of age. Indeed, I often say at 10 o'clock every night, there was more news on the telly about health data than sports news, and I think you'd probably agree. So we're really looking forward to working with you. But anyway, let's take a step back. What's this all about? Next slide, please. So I want to talk to you a little bit about the Health Data Research UK, which is the National Institute for Health Data Science and is a partnership organisation. And it's absolutely terrific this year that we're working with so many of our alliance members who will be supporting you and empowering you during your internship. But next slide. So let's take a step back. You are about to take a step into the fourth industrial revolution in healthcare. So what do I mean by that? The picture down on the right is a wee place in Switzerland. I've never been myself. It's called Davos. And as you know, every year the World Economic Forum meets in Davos, and they talk about the fourth industrial revolution. So let's just recap. The first was about steam power in the 1800s. The second was about electrification in the 1870s. The third industrial revolution was about the IT revolution, and I call that the pool revolution. So that one could access data very rapidly. The fourth, however, is quite different. It's the fusion of biology, physical sciences, computational sciences, and domains. And our domain is medicine and healthcare delivery. And what we're seeing is this fourth industrial revolution impacting healthcare very, very profoundly. And there's an opportunity to do this in a trustworthy way. So you are now doing an internship about the fourth industrial revolution, and we want you to make it a huge success. Next slide, please. So what is that fourth industrial revolution? It's about new methods, new tools, new applications. For example, artificial intelligence, machine learning, data science, which is the interface between math, statistics, computational science, and healthcare. And if we look at where health is, you see the big blue dot in the middle there. Healthcare at the moment hasn't been great at adopting these new technologies, but what we're seeing is huge investment to actually demonstrate the utility, the value, the impact of data science within healthcare. And that's what this internship is all about. Currently, we're a mid-table, so we're a bit like a West Ham. What we want you to do is to turn us into a Barcelona in terms of how we use health data at scale. Next slide, please. And this is important. So I occasionally browse, when I'm waiting for my bus, I browse The Economist. And actually in this week's Economist, there was a big article about data and tech in healthcare. So to quote The Economist, rich countries are pouring heart-stopping amounts of money into healthcare. And in the UK, we spend, government and non-government, £270 billion a year on healthcare. That's a lot of money. So by this time tomorrow, we will have spent another £750 million in healthcare. And the thesis is that's not really sustainable, because that's almost 12% of our gross domestic product. The Americans are even worse, as you know. They're 17% of GDP, spending $3.6 trillion a year. The thesis is that unless we innovate using data science, health systems will become almost unsustainable because of waste, variation, and harm in health systems. The exam question is can we use data smarter, not only to improve patient care, but also to enhance how we manage health services, and also supporting research and innovation at scale. And this is a big industry out there, almost a $2 billion industry in digital health. So this is very relevant to how health systems will run in the future. Next slide, please. But to do that, one needs coordination and connectivity. So HDR UK is a national institute, and I look forward to welcoming you to the Welcome in London. We sit just south of the Euston Road. And our mission is to unite the UK's health data to enable discoveries that improve people's lives in anticipation of the fourth industrial revolution. Because what we see is there's lots of good data, but it's often fragmented, it's not joined up, it's not standardized, it's not analyzable. Can we work at scale in a trustworthy way with the public to derive value from that data? Next slide, please. So let's look at what we call the ecosystem, which is like the map or the landscape of data. We're very focused on health data, but sometimes really exciting discoveries can be derived when we link to biological data, genetic data, or even environmental data. I was just speaking to Ian Diamond, who, as you know, is the chief statistician for the country. When we, in a trustworthy way, link health data with data, for example, on educational outcomes, it really can derive new novel insights for the value of society. So that's what we're trying to do. Build and maintain the integrity of a trustworthy health data ecosystem that links multiple data types. Next slide, please. And to do that, what our institute does is three things. We have a triple aim. We want to build research, data, infrastructure, and services. It's like power stations on a grid. You know, when we turn our television on, there are power stations and there are networks which take the electricity to where it's needed. So can we build power stations on the grid for data whilst maintaining privacy and confidentiality? We want to do that secondarily by running research programs which have huge value. And lastly, we're very big on teamwork, partnership working. So can we build partnerships and teams locally, nationally, internationally, so that we harness the benefits of data for the public good across the globe? So we have a triple aim. Next slide, please. So let's just dig into those in a little. This is a bit of a complex slide. But research, data, infrastructure, and services thinks about data as infrastructure. Now, we often think of platforms that hold data, but to do it, you need to build a community, and you'll hear a lot about the UK Health Data Research Alliance, which is the partnership of universities, NHS, trusts, government organizations who want to do this in a trustworthy way. And then we have various pillars around building the technology. Secondly, working with the publics on trust and transparency, so we govern the data in a good way. Thirdly, data engineering. How do we improve the quality of the data to make it more usable? And lastly, how do we build teams, build skills across the UK and maintain and support colleagues for their lifetime in employment? So you're now part of the team for many, many, many years, which is great. So that's how we're building data as infrastructure. Next slide, please. And just to illustrate how we're working in partnership across the UK. So there's 8 regions of HDR UK. On the right-hand side of our slide is the Welcome in London, where our offices are. There's about 30 or 40 of us who commute into the office. But importantly, we're working globally. With a lot of support from fantastic colleagues, for example, at the Gates Foundation. We're working with colleagues in the global south, as you can see from the map, in South America, in Africa, in Asia at scale. And as we saw in the pandemic, it's really important to be able to understand the causes, the treatment, outcomes of disease, not just in London, not just in England, not just in the UK, but globally. So that's a little bit about us. Next slide, please. And our journey, we're still very young and we're still learning along the way. But in terms of how we unite data, we are working with people at scale to link data across the UK, working with colleagues across the 4 nations. In terms of research discovery, we've got many publications and many data scientists working on literally thousands of projects. And in terms of promoting partnerships, we're working at scale across the UK and internationally. Next slide, please. And there's one example of that is the UK Health Data Research Alliance, which is led very ably by David Seymour and Paola Quattroni, who I hope you'll meet. So this is basically a club of really distinguished organizations who all share the same missions and values to enable access to data in a trustworthy way to enable discoveries. And as you can see, there are NHS organizations, there are fantastic organizations like UK Biobank, Our Future Health, and there's Public Health Scotland. So what we're trying to do is to provide the coordination and connectivity to allow us to perform studies on up to 66 million people, which was unimaginable 2 years ago. So that's why we work in partnership and share principles and best practice across this community. Next slide, please. And one example of that is our 9 data research hubs. I would really encourage you. There was a fantastic symposium on Tuesday in Birmingham. I think 1 or 2 of you were there. We should post the YouTube feed into the chat, actually. The highlight of the day wasn't me, because it was Rory Ketland-Jones, who you may recall was the technology correspondent from the BBC, just recovered. He gave a wonderful talk. So I would really encourage everyone over this weekend just to have a wee look at that. The meeting was to learn and celebrate the importance of these data research hubs, which have the purpose of mapping data, improving it, and making it available for research at scale. For example, the Breathe Hub looks at respiratory disease across the UK. The Insight Hub, you see they're all very cleverly named, talks about an eyesight hub. The Data Mind Hub is about mental health. And in the first 2 years, they've secured 500 projects in the UK, which weren't there before, to really use these data in a trustworthy way. Next slide, please. And gluing this all together is important. We need a shop window. And what HDR UK is doing with partners is building out in an iterative way something called the Gateway, which basically, and you can all log on to this, we should put the URL in the chat, is a way for anyone in the world to see what's going on. A single shop window for health data. And we've got about 770 data sets which can be discovered on the Gateway. And we're beginning to improve the functionality in terms of access requests and working with the publics to make sure that all projects are really visible and pass the public interest test. And the Gateway team are just a fantastic team who I hope you'll get to know. Next slide, please. So we earlier touched on our values: transparency, optimism, respect, courage, and humility. I hope you like that torch. But just to say, my door is always open. We want this to be a fantastic experience for you. With the team, you know, Sarah, Tammy are here today. We're really keen that this works well for you, we're in the spirit of improvement, always wanting to improve how we support you and empower you to do great things. Next slide, please. So just one example, because that was sort of very high level strategic. let me show you how this works. So this is a fantastic friend and colleague, Kathy. Kathy leads the British Heart Foundation Data Science Centre. When we were launching all these vaccines into the population for COVID, there was a very simple question, because they were new technologies, especially the mRNA platform technologies had never been used before at scale. And we were hoping to vaccinate 66 million people. So quite rightly, the public asked us, are these vaccines safe? A very simple question. So what Kathy did and Aziz Sheikh did and colleagues across Breathe, the British Heart Foundation Data Science Centre, Julia Hibbersley Cox, was on a population, if you add it up, 46 plus 11, 57 million people, looked at the effectiveness of vaccines and described that, that they were effective against Omicron, Delta, you remember these variants, at scale. But they also, that's the benefit, were able to articulate the risk. And early on, there was a thought that there was a significant risk of blood clots in the veins of the brain or arterial blood clots. But actually, by using data at scale, they were able to say, actually, the risk is very, 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 very low. And it is completely outweighed by the benefits of being vaccination in terms of not being hospitalized and not developing long COVID. So there's one single example of how we've used data at scale. And some of last year's Black Interns helped with this work. And my hope is that you'll be supported to do work that's really meaningful, because this work really influenced policy, not just in the UK, but globally. So health data science has come of age. Secondly, health data science is exciting because it unveils new and interesting insights. Next slide, please. And I don't just say that. Here are two famous folks. You probably recognize them. Usually they have the Prime Minister standing between them, but I've omitted him today. So Patrick Vallance said, data linkage, governance and coverage is crucial and impressive. Chris Whitty said, you've achieved a lot this year. So this is really important work, and we're delighted you're joining the team because we're still in the foothills of where we need to be. Next slide, please. So I think I've just given you a brief introduction. Can I welcome you wholeheartedly? I'm sorry this is online because I would love just to meet you in person. I look forward to meeting many of you in person over the course of your internship. Donna, who is absolutely terrific, has put some very, very useful links in the chat. Oh, Steph, thanks for putting in the YouTube. Look for Rory Ketland-Jones. He's just fantastic. And the gateway's in there. But on behalf of me and the team, just to say welcome, let's do good things, and thank you for showing interest in what we're doing as we work in partnership with the 10,000 Black Interns team, who I think are absolutely inspirational. So I'll stop there. Thank you for listening. And Donna, Sarah, Tammy, Martin, happy to take questions if that's appropriate, or allow you to march on.
Thank you, Andrew. That was really, really informative. If anybody has any more questions, please do put them in the chat, but there are a couple there, Andrew, for you already. The first question is, what difference does it make having diversity in our data and workforce?
Oh, what a good question. I should say, Mr. Anonymous or Mrs. Anonymous attendee had a very good question. So actually, diversity in data is so important. Let me give you an example. And actually, there's Alistair Denniston, who you might meet, has coined the phrase health data poverty. So let's think if we're looking at developing a new artificial intelligence algorithm. It's only as good as the data that it's tested on and the data it's validated on. And if there's a gap in that data because it's not we don't have diversity of data, that algorithm might give you the wrong answer. And that's why diversity in data is just so important. And there's a major, we've got a major problem. If you look at the genetic studies globally, so the so-called GWAS, it's called. So that stands for Genome-Wide Association Study. So that was a way of trying to initially use genetic data to define susceptibility disease. About 90% of the initial batch of studies were from European populations. And that is just not good enough. So diversity of data. So thank you for raising that. That is a big issue for us. And we're really trying to learn how we break down some of the barriers of diversity of data.
Thank you, Andrew. There's another question in the chat. What's the biggest opportunity for health data science for the future?
So that's a great question. It's the same person, Mr. and Mrs. Anonymous attendee. It's a great question. It's about impact. And, I touched upon it at the beginning. It's really important that as we harness data, we do it in a trustworthy way, that it improves ultimately quality of healthcare. And the dimensions of quality of healthcare is healthcare that's safe, that's efficient, that's effective, that is equitable, so and is timely. So yes, it is about biomedical discovery and discovery of new treatments. But if we get this right in a very virtuous way, it will be about improving the quality of health systems globally, so that the patient and population experience of, you may have heard of 4P medicine that's personalized, preventative, predictive, and participatory is enhanced. So if we're successful, we will have demonstrable impact on the quality of healthcare, and that's a good thing to do.
Thank you very much, Andrew. Are there any more questions for Andrew? Well, thank you very much, Andrew. We will circulate the slides to the interns and all the information that's in the chat as well. It's all really useful stuff. So thank you very much for your time, and we hope to see you, Andrew, at the end of the internship when the interns will be presenting their team challenges.
Oh yes, I like coming to the team challenges. We have great fun. That's a real highlight. So I will not miss that, Sarah.
Great, wonderful. Thanks very much.
Sorry, Andrew. There's one more question in the chat from Ekene. Any thoughts regarding going EPR for all NHS hospitals?
Let me just open the chat there.
It's in the Q&A.
Oh, where am I? Oh, there we go. Let me just have a look at that. Oh, so that's so Ekene, well done. That's a very good question. So what you're talking about there is the digital maturity of the NHS. Now, traditionally in the UK, general practice has been really, at the forefront of digitization. Hospitals have been very fragmented. But what we're seeing, and it's fantastic, Tim Ferriss and colleagues in the NHS, especially in England, are looking to enhance the digital maturity. That's not our job. Our job is to harness data, but we are working in partnership with the NHS at scale across the 4 nations to look at how we enhance the digital maturity across primary care, secondary care, but also social care, because it is I talk about journeys of care of patients, and we need to be able to support people wherever they are on that journey. So it's not just in primary care, it's in hospitals, it's in social care. So very good question.
Andrew, I think that there's another question popped up, if you wouldn't mind answering that as well, which is, with the data hubs and alliance partners, do they share similar data, or are data from the different partners in different formats?
Oh, that's a very good question, Anthony. So this is about data standardizations. So some colleagues do curate data which are similar. Some have quite different data types. The key here is interoperability. Can we actually standardize data sets by sometimes mapping them to a so-called data model that allows queries across different data sets? And there's huge heterogeneity in that. Some data sets are more standardized than others. But a good question, Anthony. I can see you are a future star data engineer.
Great, thank you very much. Any more questions for Andrew? Thank you very much for your time, Andrew, and we will let you know about the closing event nearer the time.
Thank you.
We'll now move on to Martin Levermore, who's chair of our Black Internship Programme Advisory Group, among many other roles. So I'll now hand over to Andrew, Martin.
Thank you, Sarah. And again, I need to thank Andrew for that exciting introduction of what HDR UK is doing and his welcoming message for our 2022 cohort. I think what we learned from the 2021 cohort is that we have got an exceptionally talented group of individuals, and I'm looking forward this year to be working with our second batch of cohorts. So let me first and foremost say welcome all for taking the afternoon and being here, and I'll just take you through the purpose of the program, the benefits of this internship, and cover summary the training we are planning to this program of 8 weeks. Next slide, please. But let's ask the fundamental question: why have a specific Black Internship program? And the slide will actually tell you what the goal of all of us were when we sat down back in 2020 in looking at the underrepresentation of Black people within this newly emerging field of data science. And specifically, if we are talking about improving patient outcome for all and democratizing healthcare effectively and prudentially, then it's about having an engaged and collective group of individuals working together on real topics that affects human science. So our goal is such, and I can only congratulate you, like Andrew earlier, in coming forward and being part of this family of new and aspiring interns. Next slide. As I mentioned, you are the second cohort. Our first cohort that comprised 48 interns across the UK came together. And more importantly, one thing I found really encouraging, that 30 of those were female. I think as of all the Black internship programs, and the majority of internship programs, we actually encourage the diversity of female engagement. And I can see in our 2022 cohort that we're doing that again and breaking ground. We had 23 host organizations last year. And again, I'm very, very pleased to see we've increased the number of host organizations. So it's going to show that there is immense value in the thoughtology, the interactions, and the engagements of Black individuals participating in this new field. Next slide. So what do we learn from the first program? Yes, it was transformational, but it was really the reactions from those interns, what they felt the program gave to them, as well as the organizations that are hosted. And you can see from the slide in front that 85% rated the program very high or high indeed. I'm looking at hopefully that we can achieve 100% this year, and no doubt lessons learned from the previous cohort will be aided within this program to improve. Importantly, 100% of the host organizations have the confidence in the ability of the interns to take forward a full-time position within their own organizations. Now, it was amazing that for a short space of time, that collective understanding between intern and organization actually, and as Andrew said, provided real world activity that could work and improve our understanding around the use of health data science and health data specifically. Next slide. But it's no good if we don't get the views of the interns and their actual experience going down. And you can see some of the feedback that we had from the class of 2021. And I will encourage this year more of our 2022 interns to talk about their journey, to share their experience, not just in this group, but broader afield. This is a new area, an exciting area. Andrew mentioned that we are just on the cusp, and we're looking forward to where we will be in 2028. But I think as we look at the fourth industrial revolution, things are moving rapidly. And you are the forefront of that movement in ensuring a trusted platform, a trusted environment to which the end user, which will be patients after all, will engage and be part of the experience as we shape how we understand the disease elements around us. Next slide, please. When I started this journey some 18 years ago in health innovation, and specifically in medical device innovation, the argument was our NHS is slow to adopt. I've never felt that. I felt that what was required was an engaging conversation for many disciplines in order to build trust. And you can start seeing from the feedback from those organizations exactly where this interaction between diverse talent and traditional medicine comes to actually improve each understanding at pace. Importantly, I would look at the last figure as 83% through the attempt and the ability to take up a long-term role within host organizations. So there's an unmet need, there's an unmet gap. So not only are we looking to bring diversity within the health data science, it is actually showing the system where the next crop of resources can be obtained and the value sets of that. Next slide, please. So, what are you going to get through the 2022 program? In summary, an 8-week paid internship, which is always good. Nobody likes doing something for nothing, but also being paid for your intellectual talents is always important. The opportunity to join, and we'll have Treasurer come and explain a little bit later, the 10,000 Black Intern community. We see this very much as a continuous engagement piece. So often I've seen with so many alumni that we start a roadmap, we finish it, but we don't continue that engagement, we don't continue that dialogue. This program, along with the 10,000 Black Interns, is about creating a lifelong community of engaged individuals. It gives the opportunity for our interns to work across sectors, be that academia, charities, civil service, and particularly interesting to me is industry. How do we translate the research into practical and convenient devices or service offerings that actually will improve the speed and efficacy of patient care? And more importantly, of all of the summary elements in this slide, is that you will be working on real world health data science projects. So not something that may within the future offer development support and benefits to society, but something that we are really tackling real life problems of today. And it's a two-way flow. It's about you also being able to use your lived experience, enabling to shape and get a common understanding across organizations. So it's a partnership on a real sense. Hopefully, like Andrew, I will be there at the end for the team challenges to see the best projects and understand the work you've all put in. And I thoroughly enjoyed being with the team challenge last year and learning quite a lot from the class of 2021. Next slide, please. This is about a practicality of engaging, and as such, Tammy, Sarah, and the team has put together quite a vigorous training program. First, understanding ELF data skills. So again, building on your Python and R and brushing up around that. And it's great to see that Amy Dobson will be there as your trainer and engaging in that. Technical challenges, understanding how data can be best used and sequencing of that in real life. And also working agilely. The other part of the program will look at health data science in action, where diversity and inclusion within healthcare meets both from a primary, acute, and ability point of view, so that we get a greater understanding of the patient journey and how best patients and clinicians will better understand the interaction of data in their clinical decision making. Careers in health data science, a researcher's perspective, to which Mavis will provide the overflow of that. And I hope I can join that session and get a greater understanding as well. And the role of NHS digital in the pandemic. There's already been discussions in the local press how the NHS app within time will act as an interface for virtual consultation. It has done quite a tremendous job over the pandemic. And again, how that platform will broaden out over the years will be interesting to see. But it is very much about taking the raw material and growing and developing it. And the personal development part of this program, being led with Laura, Chief Analyst at number 10, will actually allow you to come out of your comfort zones and blossom. Along with that, Rennie will talk about network building. Communities is about conversations, whether that in the virtual sense or the physical sense, but also ensuring that your network had value in surrounding your personal development. And I'm pleased to see Sarah Hopkins there providing and encouraging your personal coaching and personal branding. And finally, careers advice. And that will be led by Kenny, Jonathan, Chris, and Donna and Tammy, as well as others like Sasha and Kenny. So it's going to be a full pack 8 weeks, but one that is exciting. And I know only from Monday of this week that one of our Interns has already become a superstar on the global TV with her eloquent pose and discussions of her own journey and where she wants to be. Next slide, please. So it's about encouraging you to talk about your journeys, whether through blogs, whether through vlogs, or whatever social media. This is an opportunity to build your own personal profile and also talk about the significant opportunity that lies ahead within the health data science faculty world environment. It's about reaching out, not just across regions, but nationally and hopefully globally, and explaining what we are really doing in UK to really be right at the cutting edge of health data science and that of the improvement of the human being. Next slide, please. I am deeply and most grateful to all of the host organizations. Mine being Pioneer, that I know very well, but all of the others, the Art, the Health Foundation, University of Leicester, Birmingham University, those many organizations I may not be able to cover this afternoon. And the reason why I wish to thank them all is that they have got the foresight to see where we are going and the inspiration to work alongside not just the Black Interns, but many in actually improving the democracy of healthcare within our great country. Next slide. But I would be failing in my duty if I didn't also thank my other fellow advisory board members, Dr. Beverly Lindsay, Professor Louise Toner, Dorothy, Myron, who you will hear from her later on, Evans, Elizabeth, Dr. Sukrat, and Ruth. Through these individuals, they have helped frame and improve upon the 2021 cohorts program. And I think without them, we wouldn't have generally have had the consistency of coming forward into 2022. So I wish to thank them, and I'm sure they would also like to thank the team at HDR UK. Next slide. So enough for me. I would like for those of the 2021 class to come forward and give their tips, their views and advice and their experience. So I'll ask Elizabeth, Myron and Sukrat to come forward and to give their experiences. Thank you.
Okay. So thank you all for coming today. I think this is going to be the most useful session. So it'd be really helpful if you could just introduce yourselves, a bit about your background, what you experienced from the programme, any tips that you have, and how the programme has benefited yourselves. So Elizabeth, I don't know whether you want to start.
Oh, okay. I'll go first. Hi, everyone. I'm Elizabeth Odwala, a recent graduate of Bradford University, where I studied applied AI and data analytics. I currently work as a software analyst with Waters, one of the global leaders in manufacturing liquid chromatography, mass spectrometry, and thermal analysis instruments. So prior to this, I've been in the commercial industry for about 5 years, and I was at this point where I wanted to switch into a sector where I would be impacting the human, enhancing the quality of human life. And so I stumbled upon this opportunity at HDR UK. It came at a very good time where I would get practical experience on the sector I was looking to move into. So I interned at the University of Cambridge under the public health modeling unit, where I was involved in predicting model shares in cities using computer vision. Well, the goal of that project then was to encourage the goal of the project is to encourage, individuals in reducing their reliance and using vehicles and, motorcycle, starting to use bicycles and all of that, just to improve our welfare. So during my internship, I was, the host organization made sure I was involved in other units. So, I attended conferences, I learned more about all the other projects that were being run in University of Cambridge. And it was a very big learning opportunity for me, being new into this space and all of that. It gave me practical experience, and I'll give a typical example of this. Of course, after my studies, I began to apply for jobs and all of that. And then I stumbled on one application where they asked me to provide different projects I'd worked on. And so because of this platform, I was able to pick, the projects I'd worked on during my internship with University of Cambridge. I picked up the project I worked on in my team. If I could brag a little, my team won the competition then. And then I had a GitHub profile, which we were encouraged to create through one of the sessions that they organized for us. So it gave me a platform where I learned how to use R, I learned how to use GitHub, I built my own profile to be able to make myself valuable even after the internship and after my MSc studies. So going forward, I would say everyone needs to take advantage of this platform. It's very useful. The package, the training opportunities, the talks, everything is going to be very valuable. And you guys are lucky, you have 8 weeks. We were only given 6 weeks during our time. And before you know it, the time is going to fly by so fast. So as it's coming, you need to take advantage of everything that's thrown out to you. Tammy is going to be sending job opportunities. She's going to be sending links to conferences. Take advantage of it, enjoy it, make noise about it, network with your peers, network with your host organization, outside your team and every one of it. And I wish everybody the best, and we're looking to hear more success stories about it. I'll hand on to another of my colleagues there.
Thank you very much, Elizabeth. Myron, do you want to go next?
Thank you, Sarah. So my name is Myron Odingo, and I work at the University of Nottingham in health data science. I'll try to keep mine very short. And I'm just going to share some of the things that I learned. Of course, this is retrospective, and I didn't do everything here, but everyone else did them really well. So I think the most important thing I learned was that data science is very broad, and more often than not, what you're studying right now or what your background is already enough to get you in a data role. And then you just need to have a good understanding of what's happening or how they use that data science in that role. So don't feel that you need to be an expert in the IT side of things. It's just about learning how you can use your background in the world of data. So having said that, I think the two important things that you should try to do when you're in the program is to learn about the kind of work that the host organization does with data science. So what data science means for them. And as I mentioned, you could end up finding out where your background fits. And that's usually really helpful. And then secondly, opportunities may come by, as Elizabeth mentioned, there'll be a ton of those, whether it's conferences, whether it's job opportunities. Always just try to follow up and find out anything that you can get involved in. Now, I have a list here of just 3 key things that I think everyone should do, and I'll go through them one by one. So the first thing I'd say is be confident. There is going to be a session on imposter syndrome and things like that, but be confident in the knowledge that you have. You don't have to be an expert to be involved in all this. In fact, some of the people that were successful from the internship last year didn't really know much about data science when they joined in, but then they still got those opportunities. So be confident in what you have. Feel free to ask questions and get involved in everything that you can. Secondly, have a willingness to learn any new thing that a host organization is using. So you may have an interest in Python or R, but then you go to a host organization and they're using a system like OMOP. Just engage and try to learn as much as possible about it, because some of these systems are usually very useful out there. And also, getting involved in any project adds to your CV. And yeah, as Elizabeth mentioned, that is essentially work experience. And then thirdly, make sure you network. So try to talk to as many people as possible about your background, about any opportunities in the future and how you can improve. And that will give you a really good foundation for what you can do after the internship, and also possibly even open up some opportunities that may come by. And yeah, in general, I just think that you should be enthusiastic, make sure you're engaging, and just try to derive the most value out of the project. And yeah, that's all from me.
Thanks very much, Myron. That was really helpful. I'll now pass over to Shukrat, if that's okay, for your perspectives.
Yeah, hi, thank you, Sarah. Sorry, I'm a bit coffee sniffy right now. So, yes, just a brief background. My background is in medicine, so I had practiced medicine for 12 years before I came across this opportunity. And it was at a time when I wasn't in clinical practice anymore, and I wanted to, focus on research. So, coming from a core clinical background, I, was a bit hesitant at first because, I'm hearing all this programming, skills you need to have and everything. So that's the first, should I say, myth I would bust. Come as you are. You're here. The opportunities will vary. They may be what you expect, they may be what you didn't have in mind, but just be open, to all the opportunities that will come your way. And, speak up. Within the host organization, they may be involved in something that you wouldn't technically, call health data science, but it may be something you're interested in and you want to pursue. So speak up, to get those kind of opportunities. You never know where they would lead. For instance, I interned at the NIHR CRN, and a lot of their work really was, on the back end of supporting and facilitating clinical trials and research. And I got to know, about, that's where I heard a lot of about diversity in research, improving involvement of ethnic minorities in research and those kind of things. And I just showed a lot of interest in that, and the kind of opportunities it has brought up for me. I mean, this is 1 year down the line. You just never know what you're going to hear that will be of benefit. I was in a meeting one day with the team, and somebody mentioned something about being on a research ethics committee. And I said, oh, that's something I was interested in. And, I took that opportunity, followed it up. I'm now on a research ethics committee for the HRA. So don't limit yourself to technical data science issues only. Whatever the opportunities are, it could be. I also got, a lot of exposure to patient and public involvement in research. That's another thing of interest to me, and I have followed that up as well. So just be open-minded. Don't be afraid to step up, to take responsibilities when they come your way, and just absorb all the skills. The technical skills are clear, they are there, but there are also a lot of transferable skills that are very useful and valuable to you going forward. So just soak it all in, take everything, and I wish you all the best. Yes.
Thank you very much, Shukra, and thank you, Elizabeth and Myron. Martin, I just wanted to add another person's perspective, which was Tammy's, because I think Tammy was instrumental in the success of the programme last year, and I think she'll bring lots of insights to the interns for 2022. So Tammy, do you want to say a few words about what you believe is the most important thing to do?
Yeah, definitely. Thanks so much, and a very warm welcome to you all, and a very warm welcome back to some of our 2021 alumni. It's always really nice to see you all. So last year was our kind of first experience of doing this, and I think we learned loads. And my advice to you all would be, firstly, be incredibly proud that you are here. This is an incredibly kind of prestigious opportunity. And we don't own your talent, you bring it to us. It's you, you are incredibly talented people. You've done brilliantly to kind of get here. So know that you already have a huge amount to offer to us. I would say use this 8 weeks as best you can. There is a lot to fit in. The training sessions are fantastic. You will learn so much. I learned lots actually from all of our speakers last year. They all come from a really wide range of backgrounds. They will give you lots of great advice and actually be really open and ask them lots of questions. So don't feel, I always kind of say, I have a rule really that there's no stupid question. You're probably asking the question that somebody else doesn't know how to ask. So use those sessions really well and ask those panelists all the things that you really want to kind of find out. And I think as Shukrat and some of the others have said as well, ask. If you don't know, if you're in your host organisation, don't think that you can't ask, a colleague or somebody else around you. It's harder actually when you're doing that virtually. You have to be more thoughtful and considered. You can't just reach across the table and say, hey, I don't know how to do this. But again, just work through with your host organisation. If you are working more virtually, how will you contact somebody if you need some immediate support and help? Use your mentors and other people around you really wisely, and talk to us too. I think the thing that I loved the most last year was that all 48 of our interns bombarded me all the time with questions, and it was brilliant actually. It meant that I got to know you all really, really well, and I got to find out lots about you, and it meant that we could really tailor some of the opportunities that came in. So there will be lots of opportunities either around roles that are being offered or speaking opportunities, presenting opportunities. And actually that's the broader part of this as well. We want to offer you as many platforms as we can to kind of network, get yourselves out there. And it's really useful for us to find out what your interests are and what you would really enjoy doing. I think the final thing I would say as well is don't worry at the end of all of this if you still don't yet know what your career path needs to be. You will have an immense experience here, and there are lots and lots of opportunities. Andrew's talked already, as is Martin, about this is such a growing and really diverse kind of field, and opportunities are rising all the time. So don't leave after this 8 weeks thinking, I still don't know what I want to do. There are so many opportunities for you, and there are lots of things that you can try and move around, and you'll hear lots of that actually in our career talks. We've got some really interesting and engaging people. So Jonathan Beam, for example, is a really interesting individual who's kind of gone from academia, he's become an entrepreneur. So his career journey and story might really inspire and interest you. But generally, just enjoy yourselves. We certainly had an amazing time last year. It was really, really great fun. It was hard work, but we made 48 new friends. And I know lots of our interns are still in contact with us and in contact with each other. So use it as an opportunity to meet new people, make some new friends, and just have a really unique kind of experience for these 8 weeks.
Great, thank you very much, Tammy. We've now got a presentation from Treasure Oladic on the 10,000 Black Interns. So can you have the slides up, please?
Hello, can you hear me?
Yes, I can. That's fine.
Cool.
Thank you.
Hello, everyone. Yeah, hi, everyone. My name is Treasure, and I am the operations lead at 10,000 Black Interns. Great to be here. The event has been amazing so far. Very inspiring. I'm just happy to be here, actually filling in for my colleague, but kind of happy that I got to be here instead of her. But yeah, I won't take up too much of your time. I'll get straight into it. Can we go to the next slide, please? So yeah, so I'm just going to give you a bit of a background on myself. Next slide, please. So as mentioned, my name is Treasure. I actually come from South London in Brixton, which is where I am now. Grew up there all my life. I studied at Warwick University, graduated, or should I say I finished university 2 years ago. I'm graduating next Tuesday, where I studied manufacturing and mechanical engineering. Before I worked at 10,000 Black Interns, I was working full-time at another organization called Motives. And Motives was aimed at trying to help young people try to solve the world's biggest problems in STEM, so science, technology, engineering, and maths. Next slide, please. So I'm going to go a bit into 10,000 Black Interns and then our impact so far. So that's the team right now. So we have Nana, who's our program coordinator, Julie, who I'm filling in for, our senior program manager, Jacob, social media marketing manager. So anything you see on LinkedIn, Instagram, etc., that's your guy. Myself as the operations lead and Kirsty as our junior program manager. We often do get comments on how small our team is and how we manage to organize everything. And in honesty, the only answer is team spirit. Everybody dedicates themselves to their roles fully just to make sure that we can change the lives of every candidate on the program. Next slide, please. Here you can see some of our co-founders and trustees. So Jonathan Sorrell, Will Kolade, Michael Barrington-Hibbert, and David Konotia-Hulu, who are all our co-founders and also trustees. And then Faye Woodhead and Stuart Breyer, also our trustees. And they all contribute to the outline of the program, how they want things to run, and just to make sure that, you know, every candidate has an amazing experience at their host firm. Next slide, please. So our mission as an organization is to, we aim to actually transform the horizons and prospects of young Black people in the UK by offering access to paid placements across a wide range of industries, as well as world-class training and development. So stuff like, for example, so we can see that, you know, Health Data Research have put together a fantastic training program. We actually put together a training program as well, just to make sure that, you know, all the interns are as prepared as possible before going into the their internships, and, you know, they're tailored to their specific industries and everything like that. It's provided by our partners and participating firms. We also make sure that these placements are paid, as you know. So I remember myself just, you know, going through some unpaid work experiences, which were definitely good in terms of the experience. But of course, you know, sometimes, you know, money is needed to make sure that you can make things happen. And so making sure that every intern is compensating for their time is important to us, because as much as they're learning, they're also sharing their knowledge, sharing their talent. And of course, we want to make sure that all our interns on the program are well compensated for that. Next slide, please. So just to show you some stats on the program in terms of where we are today. So last year, so under the 100 Black Interns program, so 30% of our 2021 internships were converted into additional opportunities. These additional opportunities include full-time opportunities, internship extension offers, and also offers for additional internships. And that actually includes a lot of the candidates from last year's Health Data Research cohort. So again, fantastic. 70% of last year's applicants said that they wouldn't have received an internship without the program, which just goes to show the impacts that we're having as a charity, because we are a charity now. So again, which is amazing. For this year, we had 10,242 eligible applications. And so far, we've offered 2,095 internships, which is amazing. Next slide, please. In terms of today, so as mentioned, there was the 100 Black Interns program, which ran last year, and that was focused solely on investment management, just because that's where the founders wanted to start. Now we're a registered charity working with companies across more than 25 different sectors to provide insight into industry for Black students through paid internships, of which the Health Data Research are part of, which is definitely amazing. So we want to offer 2,000 internships per year, which is where the name 10,000 Black Interns came from. So 2,000 internships per year for the next 5 years. We're now partnered with over 500 companies for this year. For next year, we're looking to smash that target. So we should see where we can go. But yeah, so this year, so in terms of where we are today, the program is taking another turn, and in terms of opening up to more sectors for the next cycle of the program. Next slide, please. So I want to talk briefly on the Backstage platform. Next slide, please. So Backstage is essentially, as an organization, we're very intern-centric. And so after taking on a lot of the feedback from last year, so for example, health data research, you know, as much as there was a cluster of interns who were within health data research themselves, there were many interns who were spread out across different partner organizations. And we wanted to make sure that there was a way for all the interns to be able to connect with each other with just the interns, no prying eyes from any of the partner organizations, just to make sure that they have like a space where they feel safe and can communicate with each other, connect with each other, and just share some insight. So that's what Backstage is. So Backstage, the platform just for the interns to connect with each other. So you'll be put into groups in terms of your year of participation. So either 2021, 2022, and then going forward for those who are going to be joining the program in future years. Your sector, so for example, for yourselves here, will be health data research, and then your partner organization. This is just to make sure that within, for example, your partner organizations, you know, you can have specific conversations, but then also you can have sector-wide conversations on relevant topics, discussions, and stuff like that. So with also the platform, if you can go to the next slide, please, as well. So the platform, you receive communications about training, events, and a lot more. So as you can see, we have a notification there about training programs that were taking place for pre-internship training. We also have stuff like our Twitter feed, which shows the latest tweets on stuff that's being done by interns and by people that are partnered with the organization alike. So we can give announcements about the trustees, etc., and some of the amazing stuff that they're doing outside of the organization. Next slide, please. So this is again just an example of, this is just an example of a firm. So we have BGC partners, so we can see that they have 9 members there. It's a very specific group, and then within that, interns can, you know, post messages, connect with each other, and just make sure that you can, you know, really just get the most out of the experience. So I will say that if you haven't received an invitation to join the Backstage platform, please email interns@10,000blackinterns.com, and I'll drop the email address into the chat just after this as well, just to make sure that you can be invited to the platform and can connect with each other in the best way possible. Next slide, please. So last but not least, I just want to say good luck to everybody here. A big congratulations to you because you secured internships, you deserve it. Just make sure you engage in the process as much as possible. Learn quickly but carefully because the 8 weeks will fly past very quickly. But most importantly, enjoy yourselves. If you need any assistance with anything, I'm sure the lovely health data research team are on hand, but also us as well as an organization, we're on hand too. So again, if you email interns@10,000blackinterns.com, we'll be here to assist. But that is me done.
Thank you very much, Treasure.
No worries at all.
Shall I now hand over to Martin to chair the Q&A session? There's plenty of questions in the chat, Martin, mostly aimed at interns, but there's a whole range there.
Oh, well, that's be great. And yes, I think between all of us, we will probably find some answers to give to our class of 2022. I just want to add before we go to the questions, and it's something Andrew brought up. I think as a community, the value, which is about health data poverty. It's important. The journey that our interns go down is also acting as a communication to allow our broader community to be part of a trusted group. So you are ambassadors as well. I think it's important for that to be brought to the attention. If we are going to improve general healthcare for all, we need to have our ambassadors also being a conversation piece with their communities. So it doesn't just stop there in terms of the work and the program you're doing and the learning part. It's being also a vocal point for encouraging all in our communities to get engaged with research as quickly as possible. So, first question, Sarah, what have we got? Because I'm not very good at
don't worry.
multitasking.
So the first question is from Anonymous. What are your longer term goals for the Black Internship Programme, and do you think it could have global reach?
Oh, I'm going to be very quick. The answer to that is absolutely. And if I just take us to what's happening this year with the Commonwealth Games, with 54 countries in the Commonwealth and 74 nationalities, it is about that family, that community of spreading good practices and engaging across the field. As we have started, the second year has proven that there is interest, and I know, talking to my own NHS organisation locally, the value of a diverse workforce and what that means. But importantly, when I look outside about ensuring that we grow and develop the understanding of certain diseases, it's having that broader community engaged. And then so I've spoken only recently about the ambassadorship that Health Data Science have in being able to promote and grow. And I think, although the UK is small, we have got a large footprint globally to actually improve. And I think this program has got global reach.
Great, thank you, Martin. I think there's one now for Donna.
Yes, I'll answer two in here because they're logistics based. So Ekene has asked about the training program. Will they be on a weekly attendance or expected to run through our individual programs? So this will all be done virtually every Friday of your internship. So I've sent, or James rather, my colleague, has sent you an email with details of the training program and a Zoom link for each Friday afternoon. So you have the date, you have the time, you have the speakers, you have the speaker bios, and we'll be recording these sessions and making them available for you. So the next week's session will start next Friday afternoon, just like this one at 2 o'clock. And we have another question about your mentors. So your mentors are based in your host organizations and they will be in touch with you individually. If you don't hear from your mentor after the second week, let us know at HDR UK email and we'll chase that up for you as well. So we've sent you guidance for your mentorship meetings, and we'll be sending mentorship guidance for your mentors in your host organizations on Monday morning. Thanks.
Thank you, Donna. There's a question in the chat to all the interns. Was there anything you didn't engage in, that if you could do or do it all over again, what would you do? So can I pass that question to Myron and Elizabeth? And Shukrat, apologies.
Okay. So for me, it would probably be following through following through on the project that I was working on, just keeping tabs of it and asking stretching a hand to my host organization to see how I could still be involved, either directly or indirectly, just to still be a part of it in some way. That's something I would have done differently.
Thank you, Elizabeth. Myron, have you got anything to add?
Yes, I think for me, it's what I believe Tammy said about asking questions. Like, just make sure you ask a lot of questions. I had a specific skill set that I wanted to learn, and I really focused on getting my host organization to get me the skill set, and it worked well for me. But I feel that if I was more open-minded and I was asking questions, about everything in general, I would have just developed a better network.
Thank you, Myron. Shukrat?
My experience was the flip side of Myron's. So I was very open-minded going in. So I didn't, restrict myself to this is what I must do, this is what I must learn. So that meant that I had, I was able to take advantage of a lot of opportunities, outside, even outside the organization or HDR UK that I came across that I'm still using now. So that's one. Then for me, what I might have done differently then would have been to um maybe focus, particular time to learn some skills. I still am not Python or R literate now, 1 year after, but luckily I'm going to, learn programming in my PhD program. So it's all good.
Sarah, you're on mute.
I think I wondered whether Treasure or Tammy had any different perspectives. Treasure from a sort of broader perspective, or Tammy from what you've seen and experienced from last year's programme.
Yeah, I think just embrace everything. Know that it's going to be really hard work. Know that you're going to work harder than you probably ever worked in these 8 weeks. There's so much to take in, but enjoy it all, take it all in. And I think Martin's point actually about being an ambassador is so important. So also use this as an opportunity. You're going to learn about this as well, about to grow your network, to really start to kind of become a champion for health data, for your skill set, for being who you are. Really start to think about championing, the 10,000 Black Interns initiative. You're part of this movement that's actually challenging and really changing society, or doing some really, really exciting things. So just enjoy it, and be kind to yourselves as well. So don't try and do too much outside of it. I know it's summer and there's probably lots of exciting things that you'll be wanting to do, but don't go to too many festivals. Not this summer.
Thanks, Tammy. Treasure, have you got any sort of broader perspectives from your experience?
Yeah, I think the one thing I'll say is just probably to bring your best self to the role. And when I say that, I don't mean you should bring like a different version of yourself or a version of you that's not true to you. All I mean is that when I say bring your best self, I just mean come on your A game, come willing to learn, but also come as yourself. Because I feel like once you take away the fear or trying to be yourself in the workspace, then it gives you more energy and more capacity to actually focus on taking in the learnings, on applying yourself in the best way. And then that way you're actually able to get the most out of the internship. So yeah, that's what I'll say.
Thank you, Treasure. I think there's one from Martin in the chat, if that's okay, Martin, which is, why do you think it's so important that this initiative is running in the health data sector?
Well, for me, it's quite simple. Health should never be in the third league. It should be in the Premier League. And the only way it's going to get there is of like-minded individuals working collaboratively, also ensuring that the right drivers are pushed forward within healthcare policies so that the overall complexities of this sector is brought into a way that is convenient and easy for all. That's the bottom line. Whether we are users or participants, this is a global area with a lot of interactions, and we shouldn't be at the mid-table any further. We should be right at the forefront.
Thanks very much, Martin. Tammy, have you got something to add?
Yeah, I was going to put my diversity hat on for a moment, actually, because there's something, and Andrew and Martin and others have really touched on this, and I think the really critical thing is that diverse organisations are better. There's the moral and ethical argument, but there's a really solid business argument as well. So organisations that are full of the same people don't work, they're not successful. Society is diverse. And actually, if we aren't diverse as organisations, we're not meeting the needs of the people that need us, and we're failing society. And actually for us, I think what's so exciting about our proposition, and hopefully, you really started to kind of get a sense of what you're part of today from Andrew, Martin and others, is that we can really change things. So actually, when we think about some of the really complex kind of intersectionalities around diversity, we've talked today actually just around the fact that Black female health data scientists, that's an area that we really need to focus on. There are challenges around social diversity. There are all sorts of other really complex challenges. Actually, if we don't have people from those backgrounds in those roles, then we aren't representing society. We're less likely to be focusing on those things and platforming those things. So actually, it's really important that we have this opportunity, that we're bringing people in from a wide range of backgrounds. It means that we challenge ourselves. So just a really simple example, so you've probably seen this, actually, it was something in the news quite recently. So Professor Robert Mackaya is a really leading Black chemistry professor at the University of Nottingham. Out of 575 chemistry professors in the UK, he is the only Black chemistry professor. Now that's not okay, that's not acceptable. And actually he talks very much about not having the same funding opportunities, perhaps earning less money, perhaps not having some of the same career progression opportunities. So actually we really do have a long way to go in terms of challenging some of those kind of long held issues that exist in all sectors. That's what the 10,000 Black Internships programme is really trying to change. And actually you are part of that, you are part of this exciting healthcare journey. But there's a really big opportunity for us to work together and really change things for the better.
Great, thank you, Tammy. I can see a question in the chat that I can probably answer, which is how accessible are the previous interns to us and the current interns, and is there a WhatsApp group? And will the previous interns be attending the weekly training sessions? We have an alumni network on LinkedIn, which please do join. So that brings together the interns from 2021, 2022, as well as wider masters and PhD students and fellows. So it's a really good opportunity for you to network. A WhatsApp group is a great idea. We'd be really happy to facilitate that for you. We will perhaps issue something over the next few days just to try and set that up for you. And yes, all the interns will be invited from 2021 to those weekly sessions if they're available. There's more questions in the chat. There's one question for interns, which is about how do you juggle your university projects with this internship? So I'll let either Shukra, Tamara, or Elizabeth answer that.
Okay, I'll take this on. So for me, it happened to fall during summertime, so I was on holiday then. So it's just about time management, if you ask me. It's like the internship is like going to work. So you have your work time and then you have your extra time. You're just going to have to decide to put in the work. And it's just for a specific period of time. So yes, it's just having better time management skills. And I think it's also one of the things we were taught in one of the sessions on juggling so many things. So you'll be fine.
Thank you, Elizabeth. And I think there's another question for Treasure, if that's okay, Treasure. So what factors do you think have made this program successful?
What factors I think have made this program successful? I think it's just sheer hard work and just a real desire to make a difference. So as I mentioned earlier, quite a small team, but it's literally just a case of once you have the right motivation. So it's like what's that called? The book by Simon Sinek, Start With Why. It's about the why. So we know why we're doing this. We want to make sure that for young Black people, they are able to access the same sort of opportunities that everybody else can access, and to make sure that they're actually able to build their careers in the same way as everybody else, and to excel. And so with that why, then we know that what we do in terms of just making sure that we put in the work every day to make sure that the candidates and the interns can secure the opportunities, get the right sort of training and everything else. I think that's what makes it successful. But then also, of course, the interns themselves.
Great, thank you, Treasure. I think there's a question here for you, Donna, which is, can you elaborate on the team challenge, what it entails and how we can make the best out of it?
We didn't want to overwhelm you. This isn't even day one of your internship, this is day 0. So next Friday, you'll be getting a full update on the team project and you'll have plenty of time. So we're forming groups for you and you'll have 3 of HDR UK staff members talking to you about the project. We'll have a check-in point and there'll be a prize giving at the end. I don't want to spoil too much, but it'll be really exciting because I know that was a really big part of last year's program. But rest assured, you'll get all the information and a guidance document as well, so you can look at that at any time.
There's one perhaps for Tammy here, actually, which is, with only 8 weeks, how long should we give ourselves to start applying for jobs afterwards?
So start now. It's never ever too early to start applying, and lots of things. So what I will say is that lots of things will come up over the 8 weeks as well. So there are already lots of opportunities in this area. You may find as well that there are things that come up like internship opportunities that you might be. So one of our interns last year went off and did a year at Leeds on a 1-year placement, and that came on the back of the program that we ran last year. So don't leave it. Start right now. And actually, you can just let your, if you are fortunate enough to get a role, you can just let your future employer know that you are participating in this amazing 8-week program, which is going to set you up in really good stead for your new role. But yes, and we've got our alumni network on LinkedIn. I've actually spotted some of you are really quick off the mark here. I've got lots of LinkedIn requests from you all, which is brilliant. Do send them through. I promise I will. I'll say yes to everybody. But hook up with us and check. HDR. Check. Lots of other organisations' websites. There are jobs coming up all the time. So yeah, start now.
Thanks, Tammy. And any of the previous interns, any advice or Treasure or? Nope, we can move on then. So a few practical things in the chat, I think. Do we go to our host organisation on Friday, or do we engage and stream the content from home on those Fridays? Jonna, I would suggest that people work from their organisation on those Fridays.
That's what I've mentioned in the chat. It's to talk to your host organisations. What's the best thing to do, because you'll still be working on your projects on Friday. So it's entirely mutually beneficial for you to talk to each other and figure out.
And there's another question in the chat that I can see that Donna's answered. Is there a lead contact for us, HDR UK? Myself, Donna, Tammy, more than happy to take any questions. And there's also a general email address. But yeah, please do keep in touch during the programme with any questions that you might have.
Yeah, the general email address is manned every single day, so nothing gets lost on that. So if you send us a question, we can direct to whoever we need to, but it will be checked and you will get support.
Thanks. And Sarah, I think I spotted one about remote working, so how to get the best out of remote working. So I'm happy to give a few kind of tips. So some of you will be conducting your internship virtually, and there are kind of benefits and drawbacks to doing that. Obviously the benefits mean that you can participate from anywhere in the UK. You don't have to be located near to your host organisation, but obviously it is always really nice to kind of be, to have the experience of being in the space with others as well. And it's really hard to replicate that when you're working remotely. I think my advice is, so make sure you've got all the basics right as well. So check your kind of broadband connection. It sounds like a really simple thing, but actually go and find the best place to get good connection, because you might be on team or Zoom calls a lot. Make sure that you know how to use those things as well. So if your organization's using communication tools like Slack or other tools, or Teams, for example, just make sure that you know how to use those things. And set out really early on as well, I would say, with the person that's managing you, the best way to get in touch. So, for example, like I said earlier on, if you're not sure how to do something, it's really easy to reach over, isn't it, when you're physically next to somebody to ask for help. It's much harder to actually set up some time in everyone's diaries to, you know, to have a Zoom call with somebody. And so just agree, you know, kind of how will you get that really immediate, quick help that you need? And all of your kind of supervisors will obviously give you, you know, really regular one-to-ones. You'll probably have buddies as well. So there'll probably be somebody informally that you can contact really quickly if you need help and support. So again, it's just, you might need to be more deliberate yourselves. You might need to take the lead on some of those things rather than, you know, if somebody else can't see you, they might not know that you're struggling with something. So it's good working practice. You'll find more and more employers are offering things like hybrid working. So actually having the experience of doing this now, kind of early on in your career, is actually no bad thing at all. And it also means that you get to sit in your pajama bottoms or shorts sometimes when the weather's really nice. I promise I'm not doing that right now. But yeah, so, and I would say as well, view your home working environment as the office. So just make sure that you can switch off at the end of the day as well. It's really tempting, you know, if the laptop's there in the kitchen or in the front room, to kind of keep working into the evening. So just make sure that you have some separation, and that you build in some breaks for yourself as well throughout the day. But yeah, I'm really happy. If you're struggling with remote working at any point, just give me a shout, and I'm really happy to give you a little bit of support and coaching with that. And I know it's not easy for everybody.
Thank you very much, Tammy. I think there's probably one more for you, Tammy, in the chat, if that's okay. It's because it's about last year's programme. What has been the reception from host organisations to this programme?
Phenomenal, actually. So we had 23 host organisations last year. I think most of them are actually participating this year. There are a couple that for various different kind of practical business reasons haven't been able to participate. I think it's really interesting, actually, if I use the example of a Shipcraft organisation, NIHR. I think what they learned from the programme last year was actually astounding. You know, they thoroughly enjoyed having Shipcraft and her colleague Uche on, you know, as their interns, and they were actually just really amazed at how quickly they integrated. You know, they were just like part of their norm. So I don't think they were quite expecting that. So I actually think our interns exceeded so many expectations last year that host organisations were really keen to join this year, which is how you know, Sarah and Donna, you know, and your team have been able to double the amount that we've taken on this year. So yeah, I think we got such great feedback. We got really great public reception, lots of interest, and really interesting as well, lots of organisations approaching us when they had jobs that they wanted to offer. You know, as I said, you know, Leeds and the Data Can Centre there set up a Black Internship programme, having seen that it could happen without challenge. You know, they set up a one-year programme, which one of our interns went to. So there are really exciting possibilities, and I'm sure there'll be lots more kind of this year, because obviously the programme's now in its second year, and it's become even bigger as well. So yeah, lots to look forward to, I think.
Thank you very much, Tammy. Are there any more questions have I missed in the chat? I think some of them have been answered, most of them have been answered now. Any more questions? Please do pop them in the chat or put them in the Q&A, or please do repeat if you feel I've missed, you haven't answered any of those questions. Great. Okay, well, thank you very much, everybody. I think we've got just a closing comments from Professor Martin Levermore. So I'll hand back over to Martin if Donna can put the slides back up.
Yep.
Well, finally, thank you for taking the opportunity today to be with us, and let me again welcome the class of 2022. I'd like to thank all of the organizations who will be hosting our interns, and I'm looking forward to building, grouping, and sharing our experience as we go forward, so that 2023 will be even better than 2022. So let's have a dialogue, consistent one. Be yourselves, be your good selves, and as Andrew said, this is an exciting time. Let's make it work for all within the health data science field. Thank you very much, and thank you for your time. Take care all.